have to perform bilaterally. Number 1 through number 5, you have to perform bilaterally. Okay? So, number 1, L2 nerve root motor test is iliopsoas. There's a lot of different ways to perform the iliopsoas. If you want to use different tests, that's okay. Even though you do, as long as you do it right, it's count. That's going to be. Have a seat. Yeah, that's going to be okay. Okay, but I'm going to give you a simplest test that you can perform with the iliopsoas muscle. Okay, iliopsoas muscle is one of the huge hip flexors. So this is how you perform. Ask the patient to lift this knee up to the ceiling. Hold it up. Okay, I'm going to push this down. Don't let me do it. Hold. And lift it up. And hold. Okay? As you can see, when you feel the patient's resistance, that's good enough pressure to push it down. This is not, you're not really trying to push, try to overcome the patient. This is you are evaluating the patient whether the patient can perform the muscle testing. So as long as you feel the muscle strength, that's the good enough pressure. Okay, that was the iliopsoas test for the muscle. Any question for that? No, right? Okay. Next is deep tendon reflex test for the L2 nerve root. That's patella, right? Patella, the deep tendon reflex, you have to use this reflex hammer. Remember, when you use this reflex hammer, you have to use your wrist. Do not kill your partner. If you kill, remember he's going to do after you. He's going to pay you back. Don't worry. He's going to get you too. Okay? So, patella test, what are you going to do? You find the patella. Okay? This is the center of patella, right? So you're going to hit below this. Okay? So size of a patella, entire patella is right here. So usually it's better to hit 1/3 of a lower patella, but it's just aiming lower than center. Okay? Remember, when you perform the reflex test, don't worry, even though you don't get the reflex. It's not your fault. Your partner does not have a reflex. It's not your fault. Okay? As long as you perform right test, that's good enough. Okay? So, right? Oh, that's better, right? So, but remember, if you bilaterally. Okay? Remember, to have a reflex, you have to hit it. Because if you hit like that, that's not, that also I'm going to cut out the point for that. But if you, some of the students do this way, then if you do this way, I will cut out the point too. They find the patella. What? They really do that. I've seen a lot of students do that. If you do that, that's not enough pressure to have a reflex. Okay, so I will cut out the point. Okay, so you have to hit it. Okay, use your wrist to hit it. Do not kill the patient. If your partner say ouch when you hit this, then I will cut the point. Okay, so you have to hit it though. But remember, even though you don't get the reflex, it's fine. It's not your fault. Okay? Or in number 1 through number 5, as you can see here, there is no answer for the sensory test. So which means you have to the handout. Oh yeah, thank you so much. You're perfect. Okay. You remember this handout, right? Either you draw these pictures on the empty space, right? Either here or there, or each question you have to write it with your own word. But when you write it down, you have to be specific. Some people just says 1/3. 1/3 of where? No, you have to be very specific. So if you don't want to get bothered, then draw the picture. It's very simplest way. Okay? So either you write it down for sensory answers for the sensory here, or you draw a picture either here or there. Remember, number 1 through number 5, there's no answer for the sensory. Okay, sensory, you have to use the pinwheel. We'll hold this. So when you use this pinwheel, you have to ask the patient to expose the skin, which means ask the patient to take off their pants. Okay? It's okay. Oh, if you want to, you can do that way. Or in the during the test, you just tell me. Normally, when you perform the sensory test, you're gonna ask the patient to expose their skin. That's good enough. But if you don't say that, I'm gonna cut out the point. Okay? And then you also, for the sensory part, you have to follow these instructions too. You have to show the patient how you're going to perform the test. So I'm going to do this on your skin. And then compare the sensation on both sides. If it's different, tell me which side is more sensitive than other side. Then you're going to draw this on the patient's leg. For dermatome, as you can see on the pictures, it's along the inguinal ligament. Inguinal ligament is here, right? From here to here, in the thigh, you're going to divide into 3 different areas. Right? So L1, L2, and 3. I know you guys are going to get nervous during the practical exam. So you do strange things that you never did before. Okay? So I've seen some students do this way. I know you guys are going to laugh at it, but it happened. But if you do that, I will count the point. Okay? Remember, it's along here. Okay? You look at it. Just you have to follow this pattern. Okay? So L2 is the middle 1/3. Right? So you're going to draw on the patient. Is this feel same as this? And you have to ask it. Okay? Is this feel same as this? Yes. Okay? So because you are performing the test, you have to ask the patient. Okay? That's the L2 nerve root. Okay? Now it's L3 nerve root. Motor test for L3 nerve root is 80 doctors over hip. Muscle test is 80 doctors over hip. So you're gonna put your hand on the medial aspect of the knee. Ask the patient, I'm gonna push this knee to the outside. You're gonna push your knee to the inside. Okay, ready? Push. Okay. This side same thing. Push. Okay. That's the 80 doctors over hip. Okay. For deep tunnel reflex for L3 is patella. As you can see here, it's the same thing as L2. So you perform same thing, right? Right? And L3 sensory is a lower 1/3 on the anterior thigh, right? So you have to do this again. I'm going to do this on your skin. Compare the sensation on both sides. If it's different, tell me which side is more sensitive than other side. Okay? So and you draw it. Is this feel same as this? Okay? Then you move on. Oh, during the practical exam, you are not allowed to go back. When you decide to perform one card, you have to finish it. You cannot go back. So, if you, okay, let's say you decide 4 cards, right? During your performing, sometimes your brain get twisted, it suddenly black out. If you want to change the question while you're performing it, then I'm going to give that 1 point only. Okay? You can change your question. Remember, you compare losing entire question versus losing 1 point. You think about which one is better. Okay? If you black out during performing the test, maybe consider to change the question. Okay? Okay. Now, next one is L4. L4 is muscle test is a tibialis anterior or quadricep. Forget about the quadricep, it's crossed out the quadricep. So you're going to perform tibialis anterior for L4 muscle test. L4 muscle test, tibialis anterior is a foot dorsiflexor and inversion, right? So, but I'm not going to be too specific, but but I'm going to ask you to ask the patient to bring the foot up to the ceiling. Can you bring the foot up? 이거. Okay? When you perform L4 and L5 S1, you have to provide the patient's stability. For the adductor hip and iliopsoas is big muscle, so you don't need the stability. But smaller muscle, you have to provide the patient a stabilization. So you have to hold the patient's ankle like that. Ask the patient, can you lift this up? Okay, I'm gonna push this down. Don't let me do it. Okay, hold. Okay, hold this, and ask the patient, yeah. And then I'm gonna push this down. Hold. Okay, that's a tibialis anterior. Okay. Deep channel reflex for L4 is quadricep, right? So quadricep, deep channel reflex, you have to use this. Remember to use the tool. Okay? Remember you perform bilateral. Okay? And then sensory for L4 is lower leg along the liver and spleen channel. Right? So you have to ask the patient to roll the patient. Can you roll the pants up? Or are you just gonna tell me normally you're gonna ask the patient to undress to expose the skin. Okay? Then you have to give the instruction, same thing. I'm gonna do this on your skin. Compare the sensation on both sides. If it's different, how many sides more sensitive than other side. Okay? Then you're gonna roll the pinwheel. Okay. So I know it depends on which book you're using it. Maybe dermatome might be a little bit different, but you have to follow that dermatome that I gave you. I told you before, right? Okay, so is this here same as this? The reason I'm holding this because when those pants popping, you're not sure where you are. So you hold it. Is this here same as this? Okay. That was L4. L5, forget about extensor digitorum and gluteus medius. You just need to know extens hallucis longus for L5. Okay. Extens hallucis longus is the muscle, the big toe, hallucis is the big toe, the extension.